Well, welcome to H360 HealthTalk. We're bringing you a special series, which I'm honored to be a part of, where we are interviewing several incredible individuals associated with the Ray Pfeifer Foundation, which is a charitable organization that helps 9/11 first responders with medical needs which are not covered by insurance. Joining me this afternoon is Dominique Joseph. She is an Oncology Case Manager for the World Trade Center Health Program. She's responsible for maintaining a comprehensive case management system for the Bureau of Health Services for members of the Fire Department New York living with cancer. Her caseload, believe it or not, is over 250 active cases. We're going to hear all about that. She's also a team leader for the Fire Department New York liaison with the American Cancer Society for Relay for Life. And she is a fundraiser helping raise over $230,000 for the cause. Dominique, great to have you.
Nice to meet you. Thank you for having me.
So tell me a little about what is a day in the life of a case manager. Is there a typical day?
No, there's, it's far from typical. You don't know when you come in if it's going to be a day where you're getting new cases or somebody who was doing well or stable or in stable condition is now in critical condition. So when you walk in, you start your day just hoping that your members that you have are stable.
Now, how did you get involved in this line of work?
Luck, I think. I have a background in community health education, and for grad school I went into counseling. I never really realized I could work for the fire department, but my parents both started in the city and said I had to be a civil servant, so I happened to apply for a job as a community coordinator, doing mental health interviews for the WTC program. And after my interview, it was right on the cusp before cancer was going to be considered a WTC condition. So I was asked once we did start the program if I would be on the team.
So tell me, what kind of holistically, what does the program encompass? It's for people that were involved in 9/11 in some way. They have to have been down at the site working for a period of time. And so then if something happens, they come to you, they apply for help. How does that work?
So all of our active and with the World Trade Center program, our retired members as well do something called a medical monitoring. So annually they are assessed for their lungs, they get x-rays done, blood work. A lot of our members have been, through this screening, have been diagnosed with different cancers as a result. The medical monitoring program assessed their results prior to 9/11 and post 9/11 and continue to watch and make sure that they are fit and healthy, but they also use it as a screening tool to make sure that if somebody has something that looks suspicious, that it's caught as early as possible, when possible.
Now was this monitoring program set up very early on after 9/11, or how did that work?
The Bureau of Health Services existed prior to 9/11. As far as I know, the active responders were required to do a medical. The follow-through was a little bit more lenient at the time prior to 9/11, according to what I've been told. But after 9/11, they sort of ensured, and especially the guys that were down during 9/11, to come and get blood work drawn so that they could be tested, and it would have the data to compare for the future, because our Deputy Chief Medical Officer and Chief Medical Officers knew that something would come of all of the toxins everybody was exposed to during September 11th.
So there's a very heavy monitoring component to this.
Correct.
And then if there is a diagnosis, they get assigned to a case manager. Is that how it works? you open up the case, and you're there to provide support throughout the process for that individual?
Yes. For example, for a new case, sometimes it's a phone contact. The guy is in the hospital and they say, listen, the doctor just told me that I might have cancer. I might need some surgery, and they want to do some further testing to confirm what my diagnosis is. So what we do is we collect as much information as we can over the phone from them. We have them sign a release form to make sure that the doctors can send over any physical documentation to us. It gets reviewed by the director for cancer, which is Dr. Koffler, and then there's a latency period for certain cancers that get screened by a physician's assistant and our deputy chief medical officer and gets sent over to the federal government. So in the interim, it's a lot of, it's mostly phone contact, it's 80% phone contact. On the offset, somebody got diagnosed while they were doing a monitoring with us. Then it's a face-to-face contact, and we go over what they're entitled to in the program. I'm one of 5 case managers, so each case manager has a standard binder with information of questions to ask a doctor when you're diagnosed with cancer. We have thanks to the American Cancer Society, a resource cabinet for the different types of cancer, so that we can give them as much information as possible related to the condition that they've been diagnosed with. They're given our contact information, and from that point forward, we are sort of like a navigator for them between their physicians and the fire department and all the other pieces that lie in between.
So, I've spoken to a lot of people that have been diagnosed with cancer because of 9/11. And I've spoken to a lot of people in the medical community who are treating those individuals. And I'm hearing a theme begin to emerge that some of the cancers that these physicians are trying to treat they can't even diagnose it. They're things that they've never seen before. So when you run into a situation like that, how do you help navigate the medical system for these families that are kind of trying to understand what's going to happen, what has to happen, how much of this is going to be, taken care of for me? How does that process work?
For the rare cancers or the cancers that are difficult to treat, what we are able to do, there are a lot of studies that are being done on some of these cancers, a lot of clinical trials that are being done on those cancers. So we serve as a contact for the clinical trial physicians and refer them out to like the NIH, the National Institute of Health. They have a huge database of clinical trials that occur throughout the entire country. And so our goal is to get as much information that we have on the patient and send that information out so that they can determine whether or not this patient is eligible for this trial. A lot of immunotherapy has been able to help some of these rare cancers, but we do the best we can. For things that are a lot more difficult to diagnose, it's a series of tests to sort of confirm or target, let's say it's a metastasis or something, where we can use that information to send to the federal government to get the patient certified.
Do you see a large gap in things that are covered under the program and things that are not covered under the program?
There's a gap, but I don't know that I could say that it's a large gap. We are bound basically by Medicare guidelines for the most part. So if Medicare says we're not going to cover it, then a lot of the times it's trying to find a way we can, whether it is an appeals process that we have to go through or reaching out to external resources that we have to make sure that gap gets filled as much as possible. Like the Ray Pfeifer Foundation and the American Cancer Society, they've been really helpful to us and have stepped up to the plate for us in situations where we're not able to cover certain things. One of the biggest things that's difficult to cover are dental issues related to radiation and chemotherapy, which are hefty bills. It's difficult to say, or for our program to say, we're going to cover all of your dental issues related because you have cancer. So it fluctuates, and it's a case by case, how big those gaps are and when and where they can be filled.
So you work kind of hand in hand with organizations like the Ray Pfeifer Foundation to point those individuals, and here are some options for you. Here's an avenue for you to put in a request and see if this will be covered under them.
Correct.
And so I would imagine that from start to finish, you get to know these people fairly well, even if it's over the phone.
Yes.
What do you do to stay so composed and keep yourself? I would imagine this, number one, is a very stressful job with your caseload, and a quite emotional job because, unfortunately, we're seeing a lot of these individuals that have been diagnosed with cancer because of 9/11 passing away now. What are some of the things that you do to kind of clear your mind and stay, focused on what you need? You take care of yourself, really.
Well, that's still a work in progress. It's not always easy to shut down. Some cases stick to you a lot more than you would like them to. It's impossible to really, truly disconnect, I think. I do find ways to keep myself distracted or to decompress after a day that's emotionally taxing. So I've been known to walk home from Brooklyn to the Upper East Side. I find other activities that I enjoy, such as scuba diving and skiing, to sort of break up my day. And I volunteer at different functions that I find interesting to just sort of help the time pass and to keep busy.
So tell me a little about your relationship with the Ray Pfeifer Foundation. How did you get to know them, and what they do, and how do you work with them?
So I did a stair climb in October at Belmont.
Now, a stair climb is, tell me what that is.
The stair climb is a climb that's supposed to help the participants understand what the first responders went through climbing the 110 stories during September 11th to help as many people, rescue as many people as they can. So the National Fallen Firefighters Foundation is the stair climb. There are many stair climbs that occur with different organizations in the country, but this particular one was with the National Fallen Firefighters Foundation, which donates the proceeds to our World Trade Center counseling unit for our members that have PTSD and depression due to 9/11, and it ensures that they are able to keep their benefits that way. But so we happened to do the stair climb, and we took care of Ray, our office. I was not his specific case manager, but he came into our office multiple times and engaged
kind of a
with
loud
us.
guy from what I understand. He's larger than life, right?
Definitely.
Left no rock unturned.
Definitely.
Right?
Definitely. And he put a lot of things into perspective for us as case managers, because anytime we ever met him, no matter what he was going through from a medical perspective and how he could have reacted, he was always upbeat. His infamous line that we share with our members that are newly diagnosed, he always said he was a lucky guy and that he got to help see his kids grow up, help raise his kids, and he got 15 years that his brothers did not. So his positive outlook empowered and inspired us to be there for the guys and help them when things can seem so grim.
And when you say brothers, you're talking about his fellow firefighters, first responders, EMTs, EMS, the family.
The family, yep.
Yeah.
It's truly, the fire department is very unique in the sense that it is everybody. Some companies can say, we're a family, and they say it but may not show it. The fire department is truly a family. It doesn't matter if they know somebody incredibly well or if they kind of know them. If they hear that somebody's sick or somebody's hurt or their family needs something, you'll have people come out of the woodwork to ensure that the family, that the injured person is well taken care of.
Now, let's assume somebody calls and you pick up the phone on the other end of the line and they say, I'm not a 9/11 first responder. In fact, I had nothing, I wasn't there, but I want to donate some time, or I want to help out and give back in some way. Are there ways that individuals could do this?
They could possibly, through the fire department, no. But the World Trade Center program is a national program, and there are several organizations that do assist the program, so we would outsource them to help in those ways, or our Fired Up for a Cure benefit, which is the proceeds help our WTC responders. Aside from that, at the fire department itself, there are limited capabilities for volunteers to assist the members.
So if you were the director of the program, the big kahuna, what would you change? If you could change one thing, what would that one thing be?
The one thing that I would change for certain is the scope and the range of services that we can provide to our members. A lot of the time, certain things like latency, every person is different. Between your genetics and your other predisposed conditions, to rule somebody out and say we can't certify you for cancer even though you were down at September 11th because you didn't spend enough hours there, or we can't certify you because you got cancer 2 days earlier than what our studies show. I feel if you were down there and you were part of the rescue and recovery efforts, or you were down helping to sort body parts, you should be treated. Then I understand that's opening up the range of people that we provide services to, and possibly because of the expense of medical expenses such as cancer, the funds may be lower, but I think that's the one thing definitively I would change.
Yeah. So there are some things that I understand from speaking to others that the Ray Pfeifer Foundation has helped out with, such as wheelchairs or scooters, or I understand that even things like providing somebody that needs Depends for a month, they're doing things like that. Do you see a lot of those requests for things that aren't covered coming through your channel?
Yes. Our office got very, very lucky in the sense that Rob Ostrovsky was assigned to work at headquarters, and so we were able to have a face-to-face connection and report to somebody for equipment or services that our program can't cover. So being able to reach out to somebody and say, hey, I have this guy who needs home health aid, and we can only cover a certain amount of hours, but he has no spouse. The kids need help, or I have a guy who wants to be able to go for a walk when he feels great on the beach, but he's homebound because he doesn't have a portable oxygen tank. It makes us feel good that we can have, hey, let's reach out to Rob from the Ray Pfeifer Foundation and see if there's something that we could do to help.
Mm-hmm. Now, remind me, how many of there are you in your department?
We have five case managers.
5. And it's now 17 years since 9/11, and I'm understanding that more and more people are in need. There's more cancers now surfacing. is your department expanding? How do you see this with an increasing workload? How do you see being able to provide coverage to what's on the horizon?
The department is constantly seeking or doing outreach to see if they could recruit more people to work for the oncology unit and for the World Trade Center program. There's a staffing shortage throughout the entire city, but specifically for the fire department and the Bureau of Health Services, we're limited in terms of budget, what we can offer to somebody who would, let's say, work in a private hospital. So the outreach is there to recruit more people to join as case manager for either the cancer program or the World Trade Center Health program. It just has been difficult getting responses.
Mm-hmm.
So,
Dominique, I really admire what you do, and I do appreciate you spending time with me, so thank you very much.
thank you very much.